Well, good morning. We're Group 6, consisting of Jenny Black, John Corbin, myself, Kalisha McClendon, and Kimberly Haberly. And we are presenting to the Honorable Xavier Becerra, the United States Secretary of Health and Human Services, regarding rural hospitals being under siege, concerning the growing threat of cybersecurity attacks in rural communities.
Imagine a small rural hospital struggling to provide essential care after a cybersecurity attack cripples its systems. It's not just a hypothetical scenario, it is a reality for many rural facilities and hospitals across the US. While cybersecurity attacks are not new in rural healthcare, they are becoming more prominent in rural areas as urban areas have had resources and are harder to hack. Criminals continue to seek medical records of patients due to their value on the black market. The loss of access to a patient's record in a rural area is far more devastating to their healthcare because there are limited hospital options in rural settings. And when a local hospital is not operational, patients either have to travel extended distances or go without care. As rural healthcare providers, we are custodians of vast amounts of sensitive patient data. However, many rural facilities are operating with limited resources, outdated systems, and becoming prime targets for cyber attacks. The consequences of a breach can be devastating, not only in terms of financial loss, but of the erosion of trust between patients and their healthcare providers. Understanding the gravity of the situation is the first step. As Bardach's path suggests, defining the problem in precise terms is crucial in developing effective policy alternatives. The US healthcare sector, particularly in rural areas, faces an escalating threat, and notably in ransomware. These attacks can disrupt the critical healthcare services, exposing patient data and threatening the stability of rural health systems. Rural health systems face significant challenges in maintaining cybersecurity due to shortages of IT professionals and limited resources. Programs like Microsoft's Cybersecurity Program for rural hospitals offer critical support, but lack a comprehensive policy solutions that are needed. Rural health facilities frequently lack funding and expertise to adequately prepare to enact and maintain strong cybersecurity policies due to low to negative operating margins, limited resources, to upgrade their infrastructure serves as a barrier. Due to these limited resources, rural healthcare staffs may not have the comprehensive cybersecurity training, leaving them even more vulnerable. Cybersecurity attacks nearly doubled between 22 and 23, with rural healthcare providers being particularly hit hard. The National Security Council has highlighted the healthcare sector as a priority for advanced measures, underscoring the critical nature of its threat. The evidence is compelling, and it motivates us to deeper dive into the impacts of those cybersecurity threats on rural healthcare. Our motivation continues. Cybersecurity attacks now affect more than 88 million patients annually, an increase of almost 60% from the previous year. Security breaches in healthcare have skyrocketed 84% from 2018 to 21. The impact of rural hospitals is particularly severe as they play the critical role in the access to medical care in remote areas. The motivation behind this policy analysis is clear. Protecting the most valuable healthcare facilities is not just a necessity, it's a moral obligation. We can further justify this as the rural digital healthcare becomes more prevalent. Rural hospitals, which already struggle with limited resources, are increasingly vulnerable. The rise in these attacks demand immediate and robust interventions. Now that we have established the need for action, let us turn to the stakeholders who play a crucial role in shaping and implementing cybersecurity policies. The American Hospital Association has emphasized the importance of protecting patient safety through robust measures. The primary stakeholders in this issue include rural healthcare providers, government agencies, technical companies, and the broader public health community. While there is vast interest in safeguarding patient data and ensuring the resilience of healthcare systems, with stakeholders' roles clearly defined, Bardach's path guides us to articulate a problem statement that will anchor our analysis. Our problem statement is rural hospitals face an excess of cybersecurity attacks with more severe and lasting effects compared to urban hospitals. With a clear problem statement, we can now move to the next step in Bardach's path, identifying and evaluating policy alternatives.
Let's explore the policy alternatives. We're going to start off with policy alternative number one, which is the status quo, which is state and local cybersecurity grant programs. Before we get started, I wanted to go over the overview of the next couple of slides. So we've broken these down into what, why, and how, with a focus on making these complex concepts succinct, easy to understand, and serve as a starting point if any policy alternative is selected for implementation. We could easily fill tomes of knowledge surrounding each of these policy alternatives, but for the sake of time, have identified the most important concepts and factors that would give rise to evaluative KPIs and other measures in the event of policy alternative selection. Further, these policies are directed toward the executive implementation of existing funds and/or those that may require a request for supplemental funds in future years and are focused around awards existing and direct and/or hybrid program administration. So the what here is continue with existing federal grant programs aimed at enhancing cybersecurity infrastructure and healthcare, state and local cybersecurity grant program. The why is to protect data. Rural hospitals often have antiquated systems such as EHRs, which are electronic health record systems, that are vulnerable to breaches, and existing grants can help protect patient information. The costs, cyber attacks can lead to significant financial losses, and grants can offset costs associated with enhancing cybersecurity infrastructure. And how do we do this? We simply continue. We implement this policy as it is currently enacted and continue to do so until better policy alternatives emerge or evidence indicates that this policy is no longer recommended. And you'll also notice on this slide that we have added scope. So all of these are federal programs and they are either awards or programs with specific information attached. So this is an award, it's a general, and it's an application process. Additionally, you will see that there are citations throughout this section because we wanted to capture a variety of different sources that reflect both governmental values and those from hospitals and other associations. Next slide, please. Policy alternative number two is regional cybersecurity hubs. So what are these? Establish regionalized hubs to provide cybersecurity support and resources to rural hospitals. Why? Unified resources. Regional hubs provide rural hospitals with access to certified cybersecurity experts, improving response times and minimizing potential damage from cyber attacks. And enhanced coordination. These hubs facilitate better coordination among healthcare providers, improving overall cybersecurity readiness. How do we do this? We set up regional centers. Establish cybersecurity hubs in strategic locations that cover multiple rural hospitals, primarily through utilizing a geospatial analysis, providing them with access to cybersecurity resources and experts. We integrate with existing networks, coordinate the hubs with existing healthcare and emergency response systems to ensure rapid deployment and communication during and after cyber attacks. And we look at model practices and emerging evidence. We develop a database of cybersecurity model practices and emerging evidence for rural hospitals to prevent and respond to cybersecurity attacks. The scope of this program is federal and it is a program. Next slide, please. Policy alternative number three are mobile response cybersecurity teams. What are these? We deploy teams to respond to and mitigate cybersecurity threats in rural areas, offering immediate support and expertise. Why? Rapid support. Mobile teams can provide assistance quickly, preventing or mitigating the long-term implications of cyber attacks, and they're cost-effective. Mobile teams offer a more flexible and cost-effective solution compared to establishing permanent infrastructure such as regional hubs. And how do we do this? We build teams, establish mobile cybersecurity teams that can be directed to hospitals immediately following a cyber attack. We collaborate and foster partnerships at all levels of government for rapid and coordinated deployment of teams following the ICS Incident Command System model, which was popularized during COVID. Threat detection, equip teams with the latest cybersecurity tools and threat detection software to identify and contain threats before they cause significant harm or spread to other systems. And the scope for this is federal, and it is also a program. This flexible and cost-effective solution offers rapid response capabilities, but may face challenges in terms of resource allocation and sustained impact. The effectiveness of mobile teams depends on their ability to collaborate with local and federal entities, as well as their readiness to respond to complex threats. Next slide, please. Policy alternative number four is uniform cybersecurity standards. So what are these? We implement mandatory federal cybersecurity standards across all healthcare facilities, ensuring that even the most vulnerable rural hospitals have adequate protection. Why? The lack of standards. Clearly written, documented, and enforced standards ensure that rural hospitals implement a baseline level of cybersecurity to reduce known vulnerabilities to cyber attacks. And consistency. Enforcing uniform standards ensures a consistent cybersecurity practices across rural hospitals. How do we do this? Develop standards, create standards that define minimum cybersecurity requirements for rural hospitals, tie this to reimbursement, ensure compliance with these standards by incentivizing hospitals to meet and maintain cybersecurity requirements, and support, provide technical assistance and resources, such as free certifications to help rural hospitals implement and adhere to these standards. The scope for this is federal and it is a program. And while this alternative promotes consistency, it may be difficult to implement universally, particularly in under-resourced rural hospitals. The feasibility of such a policy hinges on the support and buy-in from various stakeholders, as well as the provision of necessary resources to rural hospitals. Next slide, please. And finally, we have policy alternative number 5, which are direct awards for cybersecurity training. What is this? Provide federal pass-through awards directly to states, tribes, and jurisdictions and/or rural hospitals for cybersecurity training, addressing the critical shortage of IT and cybersecurity professionals. Why? Workforce. Federal awards help rural hospitals address the shortage of IT and cybersecurity professionals and can offer opportunities for cross-training in cyber professional deserts. Additionally, education. Ongoing training ensures that staff are capable of responding to increasingly frequent and complex cyber attacks. How? Partnerships. Collaborate with cybersecurity organizations and academic institutions to develop and deliver no-cost training programs tailored to the specific needs of rural hospitals, such as those offered by CompTIA. Training, offer online and in-person training programs that are accessible to rural hospitals, even if they are highly remote. And certification, implement certification programs that encourage employees and potential hires to maintain credentials that foster ongoing education to keep up to date with the latest cybersecurity threats. And the scope of this is federal, and it is an award, but more specifically, this is a highly prescriptive award. This approach is both cost-effective and feasible, but its impact may be slower compared to more immediate interventions. As we have now outlined several potential policy alternatives, we must explore the evaluation criteria that will be utilized to determine the best policy for implementation. Next slide, please. In our evaluation criteria, I want to go ahead and preface this. So to systematically evaluate the policy alternatives, we've established criteria including effectiveness in preventing cybersecurity attacks, equity for rural healthcare providers, feasibility of implementation, and cost effectiveness. These criteria were sourced from reviewing the key areas of concern surrounding existing and proposed policies. These criteria were further refined to align with specific metrics that could be used for evaluation in assessing the observed outcomes. So going down through these, we have effectiveness in preventing cybersecurity attacks, which is measured by the percentage reduction of rural hospitals experiencing cyber attacks per year. Equity for rural healthcare providers, which is measured by the proportion of rural hospitals receiving cybersecurity training compared to those in urban settings. Feasibility for implementation in rural areas, the number of rural hospitals that are able to implement this policy. And cost effectiveness or efficiency for preventing cybersecurity attacks. This is measured by the dollar cost reduction for rural hospitals implementing the policy over the historical costs associated with cybersecurity attacks and the estimated cost of recovery from an evidence-based model. Also of note here is that in this analysis, all criteria are weighted equally, given the different values placed on these criteria by federal, state, tribal, and local governments, in addition to the rural hospitals themselves. Further research is strongly recommended to develop more robust standards in the future for evaluation across the spectrum of entities evaluating policies and outcomes. Applying these criteria, we can project the likely outcomes of each policy alternative, guiding us toward the most promising solution. Next slide.
Confronting the trade-offs is a crucial step in Bardach's Eightfold path. This step involves evaluating the advantages and disadvantages of each policy alternative based on the criteria we've selected. The goal is to highlight the inherent compromises and help decision makers understand the implications of choosing one policy over another. For regional security hubs, this alternative is highly effective, but with a moderate cost. The trade-off here is between the cost and the potential to significantly reduce cyber attacks across a wide area. Decision makers must consider whether the effectiveness justifies the financial and logistical investment. Mobile response teams. These teams offer a quick, effective response, but at a high logistical cost. The trade-off involves balancing the needs for rapid crisis management with the cost and potential delays in deployment across rural areas. Uniform cybersecurity standards. This promotes equity but may be difficult to implement universally, especially in under-resourced rural areas. The trade-off here is between ensuring a consistent level of protection for all healthcare providers and the practical challenges of implementation. Direct awards for cybersecurity training are both cost-effective and feasible, but with a potentially slower impact on overall cybersecurity resilience. The trade-off here is between the lower cost and delayed effectiveness of training programs compared to more immediate interventions. Balancing these trade-offs require a careful evaluation of the potential outcomes of each policy alternative. Next slide, please. Here, we're going to project the outcomes using a scale of low, low to moderate, moderate, moderate to high, or high. The outcomes have been projected for each of the proposed policy alternatives. In this case, those marked moderate have the least indication of directionality and/or are complicated by conflicting odds, such as greater equity in practice, but lower equity in cost sharing. Whereas those that lean in the specified degrees toward low or high are supported by a strong indication of the likely outcome of each policy alternative. Some of the key takeaways that we've noticed: regional cybersecurity hubs offer high effectiveness and equity, but come with significant cost and implementation challenges. Uniform cybersecurity standards ensure broad protection, but are difficult and expensive to implement uniformly, particularly in the resource-limited rural areas. Direct awards for cybersecurity training are highly feasible and cost-effective, but may take time to show results and may not reach all providers equally. Mobile response teams are highly effective in crisis situations, but may face logistical challenges and higher ongoing cost. State and local cybersecurity grant programs, the status quo, provide moderate effectiveness, but lack consistency and equity across the different regions. These projections inform our recommendation for the best course of action to address the cybersecurity threats facing rural healthcare facilities. Next slide, please. After careful consideration, we recommend the establishment of regional cybersecurity hubs. This policy balances effectiveness, equity, and feasibility, providing scalable support tailored to the needs of rural healthcare providers. However, we recognize the potential barriers to implementation and the need for ongoing research to ensure the sustainability and effectiveness of this approach. Further study is needed to assess the long-term sustainability of cybersecurity improvements and to explore additional strategies for integrating cybersecurity into rural healthcare settings. Next slide. In conclusion, we urge the Honorable Xavier Becerra and the Department of Health and Human Services to prioritize the implementation of robust cybersecurity measures in rural healthcare. Protecting vulnerable communities from cyber attacks is not just a policy change, it is a moral obligation. We thank you for your attention, and we look forward to discussing how we can work together to safeguard the future of rural healthcare. Our analysis is supported by extensive research and evidence as outlined in the final slides bibliography that has been provided.